Today we're going to be going over spinal extension exercises. This spinal extension exercise, I like to explain, it's like flossing for the spine, okay? We all floss our teeth, hopefully, to get all the little stuff out of the crevices of the teeth to prevent spinal cavities. This exercise is designed for a couple of things. Number one, increases mobility, flexibility, keeps the discs hydrated, minimizes injuries as well, and the adjustments actually hold longer, okay? So the first thing we're going to do is we're going to go over the low back extension exercises. And the way we're going to do that is I'd like you to have your feet shoulder width apart. Good. And put a little curve in your back here, please, and you're at the edge of the chair. Good. Hands across your shoulders like this, and we're going to start in this position. Ideally, we want to get it to this position. This is a little bit harder, but it creates more curve in the spine, but we'll get to that. We'll start in this position. Okay, so what I'd like you to do, this is an extension exercise, this is not a sit-up. We want to accentuate our secondary curves, low back and neck. And the fulcrum is going to be the sacrum. So the idea is we're creating this extension along the sacrum as the fulcrum, okay? Going back into extension until pain resistance or the feet come off the ground. And as we're going back to a neutral position, we're not trying to engage the abs as such. This is not a sit-up. We can, however, work the core by bringing the belly button in and up. So doing extension exercises with the belly button in and up, we'll do the flossing for the spine along with core stability, okay? So why don't we do that? All right, Kelly, this is going to be the fulcrum. I want you to come back slowly into extension until pain resistance or the feet come off the ground. So right about there, she starts to alter the mechanics. We're going to stop there, back to neutral. And what I want you to notice, she keeps the curve both ways. Go ahead and go back. Good. And back to neutral. And I'm placing my hand here as the fulcrum. This should not hurt, okay? So ideally, she's going back to a position to right about there. When you're starting this exercise, let's say you get to here and it starts to hurt, then you stop there. Every day you do this, it will get easier. Keep going. The other thing this does, by putting motion in the spine, especially the low back and the L5, L4, L3 discs, is it creates motion at the disc and it stimulates the process of imbibition. Imbibition is to imbibe, so what it does is through this motion, it's going to get nutrients into the joint, specifically the discs, and it's going to get rid of waste products, okay? This is also good if the back is hurting, if the back is tight. Ideally, again, we want these spinal curves. If I'm going for a long walk, if I'm going to play any sports, if I'm going to have a heavy workout, I'm always going to start with spinal extension exercise. It's our first line of defense. Okay, next thing we want to do, and we're going to do 12 to 20 of those ideally, okay? Next thing we're going to do is we're going to do side bends of the low back. So what we're going to do, this is the fulcrum here, and using this as the fulcrum, we're going to bend to the side. Pain resistance or the opposite cheek comes off the chair. And we're going to do 5 just for demonstration purposes. Now, she tilts a little. Let's go back into extension a little more, and now do it. You see how you feel it more in your low back this way? So when the spine is in extension and you do the lateral bend, you're going to feel it more in the low back, which is where we want it. We don't want it in the upper back. Okay, keep going. Good. Excellent. Now let's do the opposite side to the right, please. Okay, you can tell right now she's just bending at the upper back. Go back into extension a little more. Back towards me a little more. There. And now side bend to the right. Good. It's a little tight on this side, but that's okay. You feel it more here, right? In the low back. Good. And what I'm doing is I'm just putting my fingers here as the fulcrum as I'm teaching the patient client how to start this process. Good. Next, we're going to do extension exercises of the neck. So straight from this position, palms face up, resting on your thighs. Bring your shoulders back and down. right about there. Now, when we're doing these extensions, the fulcrum is going to be at the base of the neck. Typically, what people do is they do it up here. We want to do it down at the base. Now, if there's any resistance, any pain, just you stop at that point, okay? So why don't we start? This is the fulcrum. Go ahead. Back into extension. Back to neutral. Now you can see she's actually swinging her whole body. What I want you to do, just lift your chin. Back to neutral. You see the difference? Good. Do it again. Back to neutral. Excellent. And she is tight, and we are working on a reverse. We're trying to get some curvature back in here. So through a specific adjusting and extension exercises, we should be able to get these curves back. You're doing really good. Awesome. Now we want to do the side bends. And the way we're going to do the side bends, the idea is to keep the nose midline, okay? And just to side bend, the instruction is bring your ear to your shoulder. That's one. And the idea is that the nose is midline with the episternal notch. 2. Put a little more curve in your low back, please. There you go. See the difference? Good. Keep going. Curvature is key. So even though she's doing her neck, we still need that curve in the low back there. And feet are shoulder width apart, palms are up, resting on the thighs. Now let's do the other side, please. Curve your low back some more. Good. Bend to the right. 1, 2, 3, 4. Put a little more curve in your low back, please. Good. And she'll say yes or no. Is when she has more curve in her low back, it's easier to do the neck. That's basic spinal extension exercises of the low back and neck. And ideally, the instruction is do it first thing in the morning when you wake up, last thing when you go to bed. Okay?